Hello, I'm Dr. Mark Dailey, and we're talking about how gastrointestinal health relates to thyroid function. Now we're moving on to low stomach acid. Hypothyroidism contributes to hypochlorhydria, a condition in which stomach acid is too low. For someone with acid reflux, this may sound like a good thing, but in fact, low stomach acid often causes heartburn. When hydrochloric acid is low in the stomach, it cannot digest food the way it should thoroughly, or can't thoroughly digest food. The food in the stomach begins to rot and putrefy. The small intestine attempts to reject this rotting mess, so putrefied food shoots back up into the esophagus. Though the food is not acidic enough for the small intestine, it's too acidic for the delicate tissues of the esophagus and causes painful heartburn. When this poorly digested food eventually does make its way into the digestive tract, it contributes to intestinal inflammation, infection, and leaky gut. Although hypothyroidism can contribute to low stomach acid can contribute to hypothyroidism. It's estimated more than 90% of the population suffers from hypochlorhydria due to the nutrition poor diets of processed foods. The digestive dysfunction stemming from low stomach acid likewise sets the stage for an autoimmune disease, chronic stress, and poor absorption of nutrients, all of which can lead to hypothyroidism. Then let's move on to poor gallbladder function. Many people don't realize how important the gallbladder is for proper digestion. It secretes bile to emulsify fats, which in turn aids in mineral absorption and prevents irritation of the GI tract. Hypothyroidism can cause the gallbladder to become sluggish and congested. A sluggish gallbladder increases the risk of gallstones. Studies show more gallstones and bile duct stones among people with hypothyroidism. A sluggish gallbladder, and some of you probably don't have a gallbladder, but a sluggish gallbladder also hinders the liver's ability to detoxify. And remember, detoxification was an important part to getting relief from hypothyroidism in some scenarios. But poor liver detoxification not only hinders the conversion of T4 to T3, but also prevents the elimination of excess estrogen. As a consequence, excess estrogen leads to an overabundance of the thyroid-binding globulin that transports thyroid hormones through the bloodstream. Too many thyroid-binding thyroid hormones prevent thyroid hormones from getting into the cell, and hypothyroidism or hypothyroid symptoms ensue. After the last two segments on GI health and how it relates to thyroid function, it should really be an eye-opener. Get you thinking. Now, signs of GI dysfunction might include gas, constipation, diarrhea, bloating, heartburn, indigestion, sinus trouble, skin outbreaks, joint pain, foggy thinking. For people with GI problems, there may be no symptoms at all.